Something came to my mind. I just laser here, and we were wondering, how do these dental lasers work? Any idea, Doc? Lasers have issue of not having depth control. Now in dentistry, we always want to control the depth at which we are causing the reaction or doing the cutting or cautery. So what they have brilliantly done is that, for instance, this one, the dyed laser, the laser energy gets focused on the very tip of it, where we initiate with something that is dark in color. Mm-hmm. So that dark color gets energized by a laser and heats up. So the tip of the laser fiber will act like a cautery. That's how. So it's not the laser energy that is hitting the tissue. The laser energy is hitting the pigment that we put on top of the fiber, and that is what is actually causing that. Similarly, the water the laser energy would energize the water, and that water is what is causing the changes in the tissue. It's not the direct laser energy because, as I said, there is no means of controlling how far the laser rays will travel.